Well, we're joined now by the Foreign Office Minister, James Cleverly. Thanks very much for joining us this morning. Why on earth is this taking so long? It was 1 week the government announces that they're going to do it. The next week, this week, we're discovering that they're only just talking to hotels. They're going to set out the plans next week, and then it's going to be the following week before passengers can actually get into these hotels.
Well, we should remember that the package that we have announced that will come into force on the 15th of February adds to our existing package of measures to protect ourselves at the borders. Should remember that for the most part, people shouldn't be travelling at all anyway.
However, sorry, but there are 1,500 people, it's estimated, coming from these red list countries. That's what the hotels are being told to plan for. So clearly, a huge number of people are still coming into the UK from all of these countries that we've said that we didn't want people to come to the UK from at the moment. If that is happening on a daily basis, why take a month to implement something?
Well, as Matt Hancock said in your clip, we need time to prepare. We need time to make sure that this works. That's why we've given the hotel industry a notice to give them time to prepare, to train staff, and to get their rooms ready for a very different type of.
But surely this doesn't take a month. I mean, come on. You know, you say you need them time to prepare. Best Western, their head spoke yesterday. He said they hadn't even been contacted yesterday. If he ran his company like the government was running this, he would have lost his job. I mean, it is relatively straightforward, isn't it? You put people in a hotel, you make them stay in a room, you deliver food 3 times a day. It doesn't take a month to organise.
Well, we've been working with international partners who have put a similar package in place, New Zealand, Australia, for example, to see how that works. It's very easy for you to say, "Oh, all you have to do is," but hindsight is a wonderful thing. And actually, as I say, this is adding to an existing package of measures which requires a test before departure, requires a notification form upon departure, already requires 10 days of quarantine. So this is adding to existing measures. And we want to make sure that this works, that we give the hotel industry notice. Obviously, not every hotel will be doing this, and so it's unsurprising that some hotel chains haven't been contacted about this. But the package that we're putting together, this quarantine package, adds to an existing suite of measures to protect ourselves at the border.
You say we're talking to our counterparts like Australia and New Zealand. The Health Minister didn't talk to Australia, his Australian counterpart, till yesterday. Still hasn't spoken, as far as we're aware, to New Zealand about it. I mean, they've been doing this for months. Surely they've got a template. Wouldn't the first thing to do would be on the first day to phone New Zealand, phone Australia? How have you done it? What's the template? Let's get it underway in a few days.
Well, as I say, we are working with international partners on this as
very
we have
slowly.
Done. And actually, the UK has been coordinating our response to coronavirus internationally, just as all countries have done. But I think it's, I'll reinforce the point that this is adding to an existing suite of measures that already sees a requirement for testing before arrival, quarantine on arrival. This is strengthening an already strong set of border measures, and it needs to be seen in that context.
OK. Let's get back to that red list. 1,500 people a day, in theory, coming in. Why are we letting 1,500 people in? Why are we letting anybody in? Why doesn't everybody have to either go to a hotel or just not come to the UK?
Well, we've already said that travel should be minimised. That figure is not an audit of the number of people who have come. It is a planning assumption for the hotel industry to work around. As I say, we've already got very effective measures, including a moratorium on travelling. If people arrive from those countries and they shouldn't do, we have enforcement measures at the border, which could be up to and including them being returned back to the place of origin.
Those it could be, but it doesn't mean they will be stopped. And what's to stop them at the moment going via a different country?
The point we're making is that because we are insisting on a pre-departure test, we know which country people are coming from. There is already a requirement that they quarantine when they arrive, and for those people like British nationals, for example, coming from those countries that can't be refused entry at the borders, there is already a requirement that they quarantine. This is about enhancing that quarantine requirement.
Do you think setting out separate countries is really a very useful policy? Because if we look back to the first lockdown, China was seen as the source. Only 1% of those who came in to the UK were from China. 62% were from France and Spain. So actually, it was countries that we didn't know where the virus was that actually theoretically brought it to the UK. So, in a sense, is this policy much use anyway?
Well, comparing what we're doing now with what happened at the start is not that relevant. We understand.
Don't we learn lessons from the past?
We learn, but we also know a huge deal more now about where in the world the virus is prevalent, where variants of the virus are currently being detected. And our own genomic research program is helping the world better understand the nature of this virus. So we better understand now where the greatest risk is, where the requirement for quarantine is most effective. No one in the world knew as much about the virus then as we know about the virus now. So comparing the situation now to the situation in the past really is not that useful.
OK, let's get more into the nuts and bolts of how it'll actually work. Someone comes to the UK, they've come from a red list country. How do they get to the hotel?
Well, there'll be transport arranged. These are details that will be shared with the ports, with the hotel authorities between now and the go live date. These are the things where you say, "Oh, it's all right." The point is, these are the logistic things, because it won't be the same in every instance. These are the kind of logistics that we have to get right. And so earlier on, you said all you have to do is. Well, actually, as you can see, as soon as you start looking at the detail of implementing this, it's really important that the border officials, the ports and the receiving hotels are all coordinated on this, including things like travel. That's why we're giving notice. That's why we're working with the industry to make sure that this is effective when it's brought in.
And the government's going to be paying for it initially. Why is that? Because most other countries that do this immediately put it onto the travellers. I mean, if they can't afford to pay for the hotel, for the quarantine, they shouldn't be coming here, surely.
Well, we've already made the point that unless there is a very, very good reason, a very limited set of reasons, that people shouldn't be travelling at all. We want to make sure that this is implemented effectively right from the get-go, which is why we're giving notice, which is why we're working with the industry. And as I say, we'll learn lessons from international partners. It doesn't mean to say we'll replicate what they do in every instance. But this is about making that we beef up, as I say, the suite of measures that we've already got in place to protect ourselves from the international spread of this virus.
Do you think it should be a blanket policy across the whole of the UK? Because obviously Scotland's expressed concerns. Clearly anybody could, at the moment, be coming into Heathrow and then travelling up to Scotland. Well,
as I say, we know so much more about where the vaccine is most prevalent. We know so much more about how the vaccine is travelling internationally. We don't feel that a blanket moratorium is effective. And what we have done is we have used the knowledge that we have got from our coordinated work with international partners to focus on the areas of most risk, so that we have an effective and balanced approach. Because a blanket coverage would mean that we would be forcing these measures on people coming from countries potentially with very, very low case numbers, and that would potentially be counterproductive. So we've focused on the areas that we know to be of most problematic.
OK, we haven't got much longer, so let's crack on. Staying with travel, holidays and vaccine passports. In the papers today that the government is now thinking it is a good idea after saying it wasn't. Has the science changed, or is this another government U-turn?
Sorry, on what Sorry, I didn't catch on what.
On vaccine passports, the possibility of people getting a vaccine passport to go to places like Greece this summer.
Well, ultimately, the border measures of other countries and what they require of people coming to their countries will be up to them. One of the things that we are seeing now is the UK is one of the leading countries in the world. Over 10.5 million people vaccinated, 20% of UK adults vaccinated. So we're seeing that our world-class vaccine program is really giving us positive news. But ultimately,
that isn't what we're asking about, though. It's about whether or not we should actually have a vaccine passport to allow us to travel.
Well, as I'm saying,
you said it wasn't a good idea, and now it seems to be thinking it is.
The point I'm making is receiving countries will set their own border measures, and it will be up to those countries to define what they require travellers to have. At the moment, most countries, including our own, require a negative test result, and we will have to see what the international community put in place once vaccines around the world are as effectively distributed as they are here in the UK.
In terms of thinking of things across the whole UK, what about schools? Wales and Scotland are already saying schools are going to go back on the 22nd. England, Northern Ireland still holding back for the 8th of March. We know that one scientist on the nerve tag committee has said that it's a political calculation now more than a scientific one. Why can't schools in England go back after half term?
Well, we have said that we are going to review the epidemiological situation. We make our decisions about schools and other things guided by the science. So we want to basically see what the effect of our vaccine on the NHS is like before we make a final decision. So we've said that we will take stock of the situation on the 15th of Feb. That will guide our decisions. And then
it's not impossible that the government could row back and say schools go back after half term. They could make that call on the 15th. It doesn't give the schools much time, does it?
Well, the reason that we are taking an audit of the situation on the 15th is so that we can, if the situation is positive and it seems like, I don't want to run ahead of circumstances, but it seems things are heading in the right direction. And if that continues, if it gets to the place where it is safe to do so, we will then give schools enough notice so they can organise themselves to reopen. But the decision will be made based on the scientific evidence, which is assessed on the 15th of February.
OK, James Cleverly, thank you very much for joining us this morning.